Historically, nursing has its roots in holistic care, with nurses defining their role primarily in spiritual terms. Florence Nightingale, one of the most influential historic nurse figures, was a strong advocate for spiritual care. With the rise of the scientific and technological era, the focus on holistic care, including spiritual care, began to wane. In recent years, however, there has been a resurgence of interest in holism and spirituality within nursing, as evidenced by the proliferation of articles on the subject in the nursing literature. If you look at various definitions of nursing, it can be seen that the focus is on holistic care, which requires a holistic view of persons. The role of the nurse is to help clients achieve their maximum health potential, health being broadly defined. Many nurse theorists include the spiritual dimension in their nursing models, for example, Betty Newman and Jean Watson. A number of studies indicate that clients perceive that they have spiritual needs which are seen as important to them, especially in times of health crises. It follows then that if spiritual needs are not attended to, this will have implications for the level of health achieved by the client. If nurses are to fulfill their mandate, spiritual care is one of their responsibilities. This fact is well recognized in codes of ethics for nurses. For example, the Canadian Nurses Association Code of Ethics states that nursing care is designed to accommodate the biological, psychological, social, cultural, and spiritual needs of clients. In many ways, nurses are ideally suited to be involved in spiritual care, and the social climate today is such that it is becoming easier to do this.
Giving spiritual care today is, in some ways is less of a challenge because there's more of an openness. People are really starting to explore issues around spirituality. Some of the research that's been done is showing that there's a definite connection between spiritual well-being and people's how they respond and their comfort level and their response to illness is affected by spiritual well-being.
So the nurses are critical because they're often the primary caregiver in our system, and so they need to help us determine what is most appropriate for the person right now. And that's basically an informed opinion. If not, then you get chaplains working in isolation, you get nurses working in isolation, and the patient is the loser in all of that.
If nurses are critical in terms of attending to the spiritual dimension, how can they begin to tackle such a task? Well, they need to begin with themselves. Nurses need to clarify their own spiritual position and be aware of their own spiritual needs and spiritual quest. They need to be aware of the various concepts of spirituality that their clients come with and respect clients whose views may not be consistent with their own. This will enable them to be better able to assist clients in meeting their spiritual needs. Nurses also need to develop qualities that are essential for effective spiritual care.
I think the two most important qualities that nurses must possess to give spiritual care to their clients or to their patients. One is humility, and humility is not being laid down thinking you're the worst. Humility is walking in truth. When you are wrong, you say that you're wrong and you apologize. The other quality I think a nurse must possess to give spiritual care is a commitment to give. Nursing is very taxing. It drains you both emotionally and physically. Sometimes when shifts are really busy, you don't want to walk into this patient's room who might be a little bit disturbed or distraught because you know it's going to drain you. And a real commitment to give is necessary in order for her to continue to go into that room and make that effort to care for her spirit.
People really have to have a clear sense, first of all, of the difference between religion and spirituality in their own life, and have an ability to be not just tolerant, but accepting and open to learning and understanding differences and experiences of religion and spirituality in the lives of others. I think it also requires a sense of comfort about one's own spiritual life, a sense of awareness of what one's own story is and the elements of one's own spiritual life, and the ability to somehow create an environment where the client is able to share in the good old non-judgmental ways and some of the things that nurses often do very well, but not having any sense of answer. And I think that that's something that is really different than the way nurses and many other healthcare professionals have been traditionally trained. If there's a problem, we've been trained to somehow enable the person to either find the answer or give them the answer. And so it's a willingness to live with the ambiguity and the mystery and the fact that I may have only the privilege of planting a seed here. I don't have the privilege of somehow bringing it to fruition. And my experience, particularly with nurses, is that that's a very difficult skill for many of them to hone.
Well, I don't think there's any kind of special, recipe of characteristics that make a person more effective in delivering spiritual care any more than it would be for giving, excellence in nursing practice generally. But I think if you wanted to look at how patients would respond to someone who's giving spiritual care, they're going to be wanting someone who's open, who's very present with them when they're talking about things that have to do with that area of their lives. They need someone who's curious, who wants to know, why, and is able to risk take too, ask questions that might be just a little bit personal, but you have a sense of, based on what the patient had said previously, that there is something in that area they want to talk a little more about. So authenticity, caring, it's giving spiritual care or spiritual assessment is all part of the caring ethic, and it can be done in that context.
The more that nurses can have experienced their own brokenness, their own healing process, their own need for healing, then I think the more down to earth they can be, the more direct, the more honest, and can relate more meaningfully with clients, especially in a mental health setting. That's really critical, that they have worked at their own issues so that at least they're aware of their biases. It's not that we can eradicate our biases, but that at least we're aware and then can move through that to appreciate what is this unique spirituality or unique gifts of the client that they're working with. And I think they also need to be visionary in the sense that what could work in this situation? If they can have the ability to step back from the particular situation and ask themselves, what could I do differently that will help this patient have a more meaningful life?
The qualities that any nurse would need to provide spiritual care would be basic compassion, compassion for the people that they care for. And if you have that true compassion for other human beings, then you're going to have an openness to all of the dimensions in that person's life, including the dimension of spirituality. To be an active listener, really important. To be in touch with people